Hi, I am Parag Joshi, a preventive cardiologist at UT Southwestern Medical Center. I'm glad to be sharing with you some important information about coronary artery calcium scores. What is coronary artery calcium? Plaque in the walls of our arteries are an early step on the pathway to the heart attacks that we are trying to prevent. Plaques can be complex and are constantly changing. One important change is when our body deposits calcium into a plaque. When this happens in the arteries around the heart, we call this coronary artery calcium. We believe calcium helps stabilize the plaque that is built up, making it less likely to break open and cause a heart attack. The amount of calcium in the arteries is not related to the levels of calcium in your blood or if you're taking calcium supplements. It is directly related to the amount of plaque in the arteries. The part of the plaque that is calcified represents just the tip of the iceberg. What is a calcium score? Coronary artery calcium shows up very clearly on a CAT scan of the chest. Here is a snapshot of a CT scan of the heart showing the bright white calcification of one of the heart arteries circled in yellow. On this type of CT scan, we cannot see the rest of the plaque, just the calcium. Although the calcified parts are more stable, we worry about the rest of the plaque that is at risk for causing a heart attack. When we get a CT scan to look at coronary artery calcium, we can count how much calcium there is. This is called a coronary artery calcium score. In general, the higher the calcium score, the more plaque someone has. And the more plaque someone has, the higher the risk of heart attacks and strokes. In the Dallas Heart Study here at UT Southwestern, we have shown that the calcium score is the best single predictor of heart attacks. What do I do if I have coronary artery calcium? The best case for all of us is to have no coronary artery calcium, or a calcium score of 0. In general, that means there is a much lower risk of heart attacks and strokes over the next 10 years. Since we cannot see all of the plaque on a calcium score scan, we cannot say a score of 0 means no plaque, but it is reassuring. Once there is coronary calcium, we can count how much there is. The scores range from 1 to the thousands. In general, any calcium at all means there's plaque in the arteries, and you should take actions to lower the risk of heart attacks and strokes, including healthier choices around diet and exercise as a first step. For any patient, a score higher than 100 is where we recommend more aggressive treatment to lower the risk of heart attacks, which can include statin, cholesterol-lowering medications, even better blood pressure levels, and sometimes aspirin. But for younger individuals before the age of 50 to 55, any calcium at all would be a good reason to take actions to lower the risks of heart attacks and strokes. Can I get rid of my coronary artery calcium? Once we have coronary calcium, it is not something that will go away. Remember, the plaque with calcium in it is likely the more stable plaque. It is the rest of the plaque that we worry about. Statins and cholesterol medications may actually increase the process of the body putting calcium in plaques to stabilize them more and to lower the risk of plaque breaking open. Who should consider getting a coronary artery calcium score? A calcium score is a peek under the hood to better determine your risk of a heart attack or stroke. It is not for someone that we already know has blockages or has had prior heart attacks or strokes. We use it as a tool to help decide when to be more aggressive with treatments that lower the risk of heart attacks in people who have not already had heart disease. You should discuss whether it is right for you with your doctor before getting it. It is generally not helpful to repeat a calcium scan if you already have calcium in your arteries. The calcium score usually goes up over time, but that is part of the healing of the artery once you are on treatment. This can be confusing. For those with a calcium score of 0, we may repeat it again in about 5 years. For most people, insurance does not cover the cost of a calcium scan. The cost ranges from $100 to $300 or higher, depending where you live. Since it is a CAT scan, there is some radiation exposure to the chest to create the images, and in general, we prefer to limit this exposure for medical testing. That is why it is important that we only get the test if it will help with decisions on what to change in our care. Also, having a lot of calcium does not mean you have a blockage in the arteries or that you need more testing, like stress tests or invasive tests like catheterizations. These types of tests should only be considered if there are symptoms of blockages in the heart. I hope that this was informative. We covered a lot about coronary artery calcium scores. Feel free to discuss any other questions you have with your doctor.